Let's discuss diagnosis according to the 4 levels. Wei level, wind heat. In this diagnostic approach, the patterns are differentiated in relation to 4 energetic levels rather than the 6 channels. The deeper the level, the more severe the condition. This diagnostic analysis for the first time introduced the concept that exogenous pathogenic qi and thereby disease can be transmitted from person to person, and that exogenous pathogenic qi can invade the body via the mouth, the nose, and the genitals. In this analysis, the exogenous pathogenic qi is energetically hot from the very beginning, hence the term when being or heat diseases. In heat diseases, the symptoms will reflect the presence of heat, and the yin aspect of the body will be rapidly injured. Because heat is a young form of pathogenic qi, it is very dynamic and the symptoms picture can rapidly change. A person can go from being healthy to seriously ill in a very short period of time. The pathogen's young nature can also be seen in the fact that even strong and healthy people can become ill after being in contact with exogenous pathogenic heat. Many highly contagious diseases and epidemics, such as the bubonic plague, Ebola, influenza, measles, and so on, are examples of Wenbing or heat diseases. Wenbing theories differentiate not only between 4 energetic levels, Wei, Qi, Yin, and blood, but also between different types of heat, for example, wind heat or damp heat in the Wei level and lung heat or stomach heat in the Qi level. Diagnostic according to 4 levels determine the following. The disease, first the disease location, if the pathogenic qi is in the interior or exterior in relation to the 8 principles, and how deep an aspect of the interior it is that is affected. What the nature of the disorder is, whether it is deficient or excess. When Sheng Qi is strong, the condition will be defined as being excess. In general, when exogenous pathogenic qi is in the Wei or qi level, it is an excess condition. When the yin or blood level are affected, it is usually a deficient condition. In contrast to the 6 stages, all the patterns of imbalance are heat imbalances. About how the disease develops is a dynamic process that is constantly changing, especially in the beginning. As with the 6 stages, this diagnosis model is used to assess the relative strength of Zheng Qi and exogenous pathogenic qi in relation to each other. It can also be used to gauge the direction in which the disease is moving. If the disease is penetrating downwards, it is a negative sign. If, on the other hand, the symptoms change from one of the deeper levels to symptoms of one of the more superficial level, it is a positive sign. The treatment principle, the nature of disorder determines how it should be treated. If there is heat in the Wei level, it must be expelled outwards. If it is deeper down, it must be drained. If there is deficient condition, that which is deficient needs to be supported, and so on. Wei level. It is the most superficial level and is very similar to the Taiyang stage of the 6 stages. It is the first level that is attacked by an infectious disease. Many of the symptoms and signs are indication that Wei Qi has been disrupted in its function and activities. Many of the symptoms and signs are the same as those seen in the Taiyang stage. But in this level, there is heat, and this means that there are also differences in the symptom picture. Differentiation is made between invasion of different types of pathogenic heat: wind heat, damp heat, dry heat, and summer heat. Wind heat is the most common and most important differentiation, especially for acupuncturists. Next is the wind heat. At first glance, wind heat appears to be very similar to an invasion of wind cold. in the tying stage of the 6 stages. But when there is wind heat, there is less aversion to cold. Even though there is less aversion to cold, there is still an aversion to wind and cold. This is because the invading pathogenic qi blocks the circulation of the warming Wei qi. The disruption of Wei qi can also be seen in the fact that there is often little or no sweating. There can also be a headache, but where the headache in the tying stage was tight in nature, the headache seen in wind heat imbalances is more pounding or throbbing. This is due to the expansive dynamic that heat has. Heat will cause the person to have a fever or feel feverish without necessarily having an elevated body temperature. The heat will often be palpable on the person's forehead, which will feel warm to touch. Heat will damage the fluid and make the person thirsty. Their pulse will be rapid. Wind heat can disrupt the functioning of the lungs, resulting in a cough or sore throat. For the etiology, contacts with exogenous pathogenic heat. For the symptoms and signs, there is acute fever with mild aversion to wind and cold, no or little sweating, throbbing headache, thirst, sore throat, red swollen throat, cough, irritability, restlessness, yellowish or dried mucus in the nose, forehead may feel warm when touched, the tip of the tongue may be red and there may be a thin yellowish coating on the front of the tongue, rapid and superficial pulse. The key symptoms, fever and aversion to cold, rapid and superficial pulse. For the treatment principle, we have to expel wind heat, activate Wei qi. For the acupuncture points, we have to choose from do 14, Li4, Li11, lung 7, lung 10, lung 11, UB12, UB13, and GB20. Needle technique is draining, cupping is recommended. For the explanation, do 14 activates Wei qi and drains heat. Li4, Li11, lung 7, UB12, and UB13 expel wind and heat. Lung 10 and lung 11 drain heat from the lung and throat. GB20 expels wind and drains yang from the head. Relevant advice: when there is an invasion of wind heat, it is best not to eat or to only eat light food. The person should drink tea that is both cooling and spicy. For example, elderflower, chrysanthemum, or mint tea. An invasion of wind heat can be caused by the following pattern of imbalance. No previous pattern. An invasion of wind heat can result in the following pattern of imbalance, like Qi level heat, Yin level heat. Thank you for your attention.